It's typical during an election season to hear Democrats try to scare people into believing that Republicans want to destroy programs that Americans rely on for their health and security. We've recently heard this on Medicare and Social Security. Now there's a new subject added: health insurance. The programs are different, but the scenarios are the same. The Democrats concoct a story, attribute it to the president and to Republican members of Congress, and then turn to their allies to amplify this false narrative. What really stands out this election season is how those all too familiar scare tactics directly contradict the message coming from the presidential nominee of the Democrat Party. Vice President Biden says he's for hope, not fear. His actions and those of his party show just the opposite. So let's start with Democrats' efforts to pin Medicare's financial struggles on Republicans. The facts tell a much different story. Republicans have fought for decades, often in the face of Democrat resistance, to keep Medicare strong, not only for current enrollees, but for their children and grandchildren. For instance, in 1995, President Clinton vetoed Republican efforts to keep Medicare on sound financial footing. Faced with the prospect that the Medicare Hospital Insurance Trust Fund was going broke in just a few years back then, Republicans still pressed on. It was the work of a Republican House of Representatives and a Republican Senate that ultimately convinced President Clinton to sign the Balanced Budget Act of 1997. That act of 1997 extended the life of the Health Insurance Trust Fund, but it was not a silver bullet to solve the Medicare's program's long-term financial challenge. For many years, spanning both Democrat and Republican administrations, the Medicare trustees have cautioned that the program's financial shortfalls require further legislative action. The trustees repeatedly advised Congress to enact such legislation sooner rather than later to minimize the impact on beneficiaries, healthcare providers, and taxpayers. Republicans know how important Medicare is to the over 60 million Americans who rely on the program for their health care. But we also realize that Medicare is on an unsustainable course. I have always said that we need to work in a bipartisan way to protect Medicare, particularly here in the United States Senate, where it takes 60 votes to get anything done. That work requires an honest assessment and a very serious discussion. Sadly, it seems that Democrats are only willing to take their heads out of the sand long enough to point fingers. So let's set the record straight. Earlier this year, the trustees of Medicare projected that that program would be bankrupt in 2026. And then, of course, we have this unprecedented public health emergency dealt with, the pandemic that we always call it, dealt a crippling blow to our nation. The sacrifices and efforts made to stop the spread of the coronavirus effectively shut down the United States economy and altered life as we all know it. Congress stepped in to provide federal relief. The COVID response bills were passed on an overwhelming bipartisan majority. Specifically, the CARES Act, better known as the Coronavirus Aid, Relief, and Economic Security Act, passed the House by a vote of 419 to 6, and the United States Senate 96 to 0. CARES gives extra Medicare funding to hospitals and other healthcare providers to keep them in business in the face of an unexpected drop in demand for medical services. Additionally, because of Medicare Part A is financed by payroll taxes that are split between employers and employees, unemployment caused by the pandemic has resulted in less money coming into the trust fund. So, it then is not surprising that the Congressional Budget Office estimated earlier this month that the Medicare Trust Fund could run out of money in 2024, 2 years earlier than the Medicare trustees had projected, without taking into account the impact of COVID, because they didn't know about it and couldn't take that into consideration. It's important to note that during the Trump presidency and prior to the pandemic, the projected insolvency date of the Medicare Health Insurance Trust Fund remained pretty steady. No one could have anticipated this current crisis. Instead of taking it as a reminder of the need to shore up Medicare for the long haul, Democrats have opted to create a false narrative that the current administration is the problem. Every recent president, Republican and Democrat, has offered Medicare reform ideas in budget requests submitted to the Congress. Many of those budgets contained identical policy ideas, whether from a Republican president or a Democrat president. Putting aside that Congress, and not the president, makes laws, the notion that proposals aimed at making Medicare more efficient is equivalent to sabotaging the program is absurd. Yet, whenever a Republican occupies the White House, we repeatedly hear from Democrats that proposals for program integrity represent cuts or efforts to weaken or destroy Medicare, even when some of those same proposals were put forward by Democratic administrations. Because Medicare is on a path to bankruptcy, the greatest threat then is what often happens around here: inaction. Over the past decade, Democrats not only stood firmly in the way of meaningful Medicare reform, they actually made the problem worse. Rather than confront the looming crisis in 2009, President Obama, Vice President Biden, and Washington Democrats raided more than $700 billion from a Medicare program. They didn't do it to save Medicare. They cut money from a financially strapped Medicare program and then spent that money on a brand new entitlement program called Obamacare. It was the Democrats who pushed Obamacare through Congress without a single Republican vote. And what do Democrats want to do if they find their way back into power? They want to enact something called Medicare for All. Moving the 180 million Americans with private employer-based insurance to Medicare rolls would cause federal spending to balloon to unthinkable levels. An analysis conducted by the America Center in 2018 found that Medicare for All would increase federal spending by $32 trillion over the next 10-year period. This Democrat plan would also give the federal government more control over health care, impose massive tax increases on the middle class, and disrupt access to services. That's why Democrats would rather mischaracterize the unavoidable impact of COVID and demonize Medicare budget proposals that are often bipartisan in nature. Democrats use the very same dirty tricks related to Social Security, as I just talked about with Medicare. Some across the aisle recently concocted a hypothetical proposal that eliminates the funding source for Social Security and asks the program's chief actuary to assess its impact. This was an obvious attempt to alarm seniors and disabled Americans with the ultimate intent of smearing Republicans and feeding false talking points to a Democratic candidate for president. Even when their schemes and false talking points earned 4 Pinocchios from even the Washington Post, Democrats still proceed full speed ahead with their misinformation campaign. And even though Ways and Means Committee ranking member Brady and I got the Social Security actuary to affirm that the Democrats' recent scheme was just a bunch of malarkey, the Democrats and candidate Biden continue with this misinformation. Again, Democrats use scare tactics in the run-up to an election. While they accuse Republicans of wanting to destroy Social Security, Senate Democrats do little or nothing to work in a bipartisan way to help this program. Remember, in 2015, when the Disability Insurance Trust Fund was going to run dry, Senate Democrats demanded that the only thing that you could possibly do to take was to take from the retirement trust fund and then just simply kick the can down the road. Senate Democrats had no interest in working with us to at least try the disability insurance program to make it better for the beneficiaries. Instead, Senate Republicans worked with the House and Obama administration to prevent disability insurance trust fund exhaustion and even to improve the program. There was no privatization of anything, and the only thing that could be construed as a benefit cut came directly from President Obama. Now, you won't hear anything about that from these Senate Democrats. Instead, they just bring out their stale talking points and, of course, scare tactics about Republicans trying to destroy the program. Now, they're applying the same worn-out, baseless scare tactics to this Supreme Court confirmation process. Democrats want to make the president's nomination to fill the vacancy all about Obamacare, and the case the court will consider this fall. Now, going to the minority leader's own words, when it comes to Judge Barrett's confirmation hearing, quote, "We must focus like a laser on health care," end quote. The left is misrepresenting an article by then Professor Barrett in hopes of finding something, almost anything, to gum up this confirmation process. And it seems to me they're just frustrated. This nominee had the audacity to suggest that judges interpret law as written. Now, there's an old saying in the legal profession: if the law isn't on your side, pound the facts. If the facts aren't on your side, pound the law. If neither fact or law is on your side, just pound the table. That's what we see yet again from our Democrat colleagues. It's ludicrous to pick one pending case and predict how every member of the court, including one just starting the confirmation process, would vote on that case, especially when entirely different legal issues are at stake. Frankly, it's a disservice to the American people. The Democrats know this, but that won't stop them. Won't stop them from trying to mislead hardworking Americans into believing that their health care coverage could disappear tomorrow. It's also just the latest example of how many Democrats in Congress view the Supreme Court. Just somehow another policy end that they can't accomplish through this branch of government where we are now. That's not the role of the court. And I'm sure that Judge Barrett will reiterate that point during the Judiciary Committee. The Supreme Court will hear oral arguments in the case mid-November, and there are countless scenarios on a potential outcome. So it's useless then to speculate, but that won't stop the Democrats from speculating during this process of Judge Barrett's nomination. The bottom line is, no matter the decision, no one will lose health care coverage on the day that the Supreme Court issues its ruling. In the meantime, Republicans will continue to protect individuals with pre-existing conditions and fight to give Americans more affordable health care options. The President reaffirmed that very thing in his commitment in an executive order that he signed last week. That executive order states that it has been and will continue to be the policy of the United States to assure that Americans with pre-existing conditions can obtain insurance of their choice at an affordable price. The Democrats don't want to stop at Medicare or Obamacare. What they really want to do is impose their government-run Medicare for All program and take away people's private insurance plans that people like, because 160 million people have it. As I mentioned earlier, this one-size-fits-all approach would take away people's private insurance, result in worse care, and bankrupt the country. Republicans want to strengthen Medicare, preserve Social Security, and ensure affordable private coverage options now as well as in the future. Democrats want to mislead now in hopes of future political gains. Americans deserve better. We can do better. Vice President Biden and his party should stop their shameful election year scare tactics. They should end the malarkey. It's time to have the courage to engage in an honest civil conversation about bipartisan ideas to improve these health and security programs for millions of people who depend on them. I yield the floor.